Every year, hundreds of people gather at the Statehouse with family, friends, and others who help them for the Rally for Recovery.
This is great because people that are in a hopeless spot or at rock bottom or just need something can come here to these events and get hooked up with the programs that will work. But it all boils down to how much they want it themselves.
Now, once you go through that detox and you do that little 30-day program that they have there, then you're out on the street and you have no furthermore recovery than that, other than going out and going to meetings and doing things like that. Without that, there's nothing, and yeah, there could be more aftercare.
95% to 98% of these people that we're dealing with our 855 number do not have insurance, or they have Medicaid, and try to place somebody in detox or into recovery is near impossible.
I think the state is doing the best they can. I think there's a lot of resources in Ohio. Ohio has the dubious honor of being, the number one state in the country with dealing with the opiate epidemic and overdoses.
To leave behind killer drugs and make it into recovery, money is key, and specifically state money. I talked with Governor John Kasich about that in October.
Is the state spending enough money proportionate to how this kind of an increase in death?
We've had a giant increase in this period over the last few years. Do I think that spending a heck of a lot more money is going to, you could always use more money. You could always have more recovery beds. You could always have this. But I think it's been a significant increase. And we're starting to see results. Because of the tightening of our prescribing guidelines, we've seen like a 20% reduction in the number of doses prescribed. So it's all working. But we're not going to get out of this overnight.
Kasich says deadly overdoses from prescription painkillers are at a 6-year low, and he credits the state's crackdown on pill mills in 2011. But heroin deaths have soared 327% since 2010, and deaths involving fentanyl are up nearly 10 times that. Democratic U.S. Senator Sherrod Brown says he's wondering about state lawmakers' reactions to the crisis.
What are they doing? They're not doing enough. I mean, we're not scaling up. We're not scaling up the treatment programs quickly enough. Clearly, the state legislature keeps trying to cut Medicaid spending. I mean, when there are 200,000 families in Ohio right now, 200,000 people that are getting opioid treatment because of the Affordable Care Act.
But Ohio House Finance Committee Chair Ryan Smith, a Republican of Gallup Police, says $20 million was put into the state budget for new treatment facilities, and more money was added for kinship care, child protective services, and drug and mental health courts.
I'm a little bit offended, frankly. I think we tried to address it even amidst a $1 billion hole last year. And we put $180 million into it. And I'm sure people can say it's not enough and that type thing, but we have to budget responsibly, and I felt like we did that to try to address an epidemic that certainly needs some attention.
And a document provided by the State Office of Budget and Management says money that the state is counting as opioid crisis battle funds shows it kept pace with opioid deaths as tracked by the Ohio Department of Health. Funding skyrocketed in 2013 as Medicaid expansion was enacted in Ohio and as overdose deaths soared. But in the last 2 years, the numbers of overdose deaths have risen faster than the money the state says it's putting aside to fight the epidemic. There is no breakdown on federal money versus state funds, but the Kasich administration has said that 2/3 of the nearly $1 billion now being spent to fight the opioid crisis is federal money, most of it Medicaid expansion dollars. Twice, Democratic state lawmakers have called for money from the state's rainy day fund, and they want Kasich to declare an emergency. His Drug Addiction and Mental Health Services Agency Director Tracy Plowk says the state has been operating as if the crisis is an emergency for several years.
We've introduced more resources, we have changed policy, we have worked to activate, in collaboration with communities. And so I feel very strongly that we have been treating this like an emergency for the last 6 years.
But as for the Rainy Day Fund, the Kasich administration says the Budget Stabilization Fund, as it's known, should be used as a last resort in a financial crisis. Karen Kassler, Statehouse News Bureau.